Dear colleagues, ladies and gentlemen, good morning, bonjour. Unfortunately, my French is too poor, so I have to speak in English. I hope you will not have any difficulties to understand what I'm going to talk. First of all, I would like to thank the organizers, specifically Michel and Sigvaris, for this invitation. And what I would like to do is, I would like to give you a report on a meeting which we had from the ICC, International Compression Club, in Lucca last September. And the central question of this meeting was, which methods in clinical medicine do we have in order to prove efficacy of compression treatment? As you can see here, the International Compression Club was quite active. We had several working groups, and all these subjects which are listed here have been published. And you see it's an international cooperation between French, German, English, Italian colleagues, and the last one, effects of compression therapy, is in preparation. So in Lucca, we talked about these subjects, and this is the list of contents what I'm going to report to you. We started to discuss the question, how can we measure the compression pressure and the stiffness of compression devices? And we had a consensus paper on this subject already some years ago, saying that the central point of compression is the dosage, and the dosage can be measured by sub-bandage or interface pressure measurements. And today we have several instruments available. This is a machine coming from Sigvaris. This is a new Italian device, and this is the Kikuhimi, which most of you already know probably. In order to find the reproducibility and the accuracy of these devices, we, together with Giovanni Mosti, we did very simple experiments. We put these three probes on a cylinder, on a bottle, wrapped over by a blood pressure cuff. We blew up the pressure to 10, 20, 30, up to 80 millimeters of mercury 10 times, and looked at the reproducibility and accuracy compared to the cuff from the SIGAT tester, PicoPress, and from Kikuhimi. And what you can see here is that the range is quite narrow for all these three devices, so you have very good variation coefficients, at least in that range, which is important for us in clinical medicine. And we also can show that the accuracy compared to the blood pressure cuff is very good for all the three devices, with a maximal deviation here in that range over 70 millimeters of mercury, in a range which is not anymore relevant for clinical medicine. There was an interesting idea coming from France, proposed by Jean-Patrick Benini, to introduce a so-called friction index. As we know, the stiffness of a compression device is going to be changed if you apply several layers over each other. And this is due to the friction of this surface of these devices, compression devices. So this is an interesting new approach. I'm not sure if we have already any data on that, but this could be quite interesting in the future. My next point, how can we measure edema? We started with a presentation by Monika Gnadecka from Copenhagen, who showed excellent pictures derived by high-frequency ultrasound in different kinds of phlebological diseases. And this is an excellent method how we could really also show effect of compression treatment. There was one presentation from Martino Neumann showing that by plethysmography you can assess what he calls capillary filtration rate. And it has been shown by Martino Neumann's group that this capillary filtration rate can be reduced by compression depending on the pressure and on the stiffness. I'm sorry, there are some lines left here. I don't know how this, it comes, look. Oh, that's strange. So, medical compression stocking with low pressure and high slope are equally effective as those with high pressure and low slope. And again, this stiffness, we are going to discuss this point later on after the next presentation. He could show that there was a strong edema prevention by medical compression stockings with high slope profile. So we should also take into consideration not only the pressure of the stocking and of the material, but also on this kind of slope or stiffness. The durometer is an interesting device where you can measure objectively the hardness of the skin, like in lipodermatosclerosis, and this could also be used in order to show the effect of compression. No studies have been done in this field up to now. Limb volume, there are several plethysmographic devices, Archimedes principle, water displacement for the upper extremity, new method introduced by Robert Damstra from Holland. And you probably know these simple devices. What I learned here in Paris with Michel Vessara was this device where you can quite measure precisely the volume of a lower extremity of the lower leg by water displacement. Also, Eberhard Rabe proposed a kind of other instrument in this. And what is interesting is that by this device you can really show that very low pressure is already effective. I had always discussions with Robert Stemmer, and he asked me, what method do we have in order to prove that these very low pressure stockings are having any effect? So this water displacement volumetry is certainly an ideal method to show this. This is a study which I did together with Bertrand Lune, whom I'm seeing here, and with Wieninger from Sigvaris, and we saw that in healthy volunteers, in the evening, the legs were always thicker than in the morning. So this is the difference between evening and morning volume of the leg, and this is what we call edème vesperal en français. And you see that all the stockings which we used were able to reduce this evening edema significantly, and already a class A, which is a French class 1 stocking, exerting a pressure of 10 to 15, is able to reduce significantly this evening edema in healthy volunteers. So this may have some importance for occupational medicine, for instance. All of us, we are sitting and standing the whole day, so we can prevent this physiological swelling by putting on very low pressure stockings. Barometer, body scan, bioimpedance, this is a large subject. You could have 1 or 2 days to show experiments with these devices. Interesting studies came again from Paris. Jean-François Hull presented this idea of measuring the thickness or the volume of a leg by CT scan. And he was also able to show that with increasing pressure, Sigvaris 504 here, you get a reduction of this volume of the lower leg. So rather sophisticated method, I would say. You can have three-dimensional photography in order to assess the leg volume. As you know, this has been taken over by a company which produces stockings following this volumetry. Venous diameter, how can we measure the venous diameter? So one simple method is the duplex combined with what we call an echo cuff. This is an American patent. I know there is also a patent from France, but this was developed quite independently. By applying this window over the duplex transducer, we can visualize the veins. As you can see here, this is the small saphenous vein, and when we start to compress the lower leg, then this happens with a pressure of 30, and with a pressure of 50, this vein is emptied, so we can measure the influence of compression on the venous diameter by this method. Such elegant pictures come always from Jean-François Lhull, and I think this is the thigh of André Coinutenard. Is it correct? This is, you can see that. You can see that. This is the cross-section through the thigh of André, and what they did here, they applied a pressure device, an invention by Jean-Patrick Benini, and this is the core of the device, and you get such beautiful pictures showing the compressive effect of this wedge-like device on the superficial veins and even on the deep veins. We did some studies together with Giovanni Mosti in Lucca, also with magnetic resonance. You see edema, and after 6 hours of compression, you can see by naked eyes the reduction of edema. We did also some experiments in Genova, where they have a device, a magnetic resonance device in the standing position. This is more relevant for the veins, and you see that in this position, in the standing position, we find sometimes large calf veins, muscle sinus, which can be compressed by stockings, for instance. Joint mobility was one subject. Jans Huren presented interesting experiments with goniometry and other devices to measure the extent of mobility, of the joint mobility. Venous flow velocity can be, of course, measured by duplex today, and there's a lot of literature, especially coming from intermittent pneumatic compression machines and from thromboprophylactic stockings, that such devices are able to increase venous flow velocity. I don't go into detail here. I just want to come to the next point, which is venous reflux. And these are pictures which you have seen already by André, experiments where he could show that increasing pressure on the lower leg decreased the reflux in the saphenous vein proximal in the uncompressed part of the thigh. Similar experiments were done completely independently by Giovanni Mosti. He used this kind of duplex probe, an interesting probe. The advantage of this is you can fix it to the skin, and then you have a more, always the same picture, so to say, you don't move. Venous pumping function. This is, of course, the main point which is of interest in people with chronic venous insufficiency. Are we able to improve venous pumping function by external compression? And these are old experiments which we did with foot volumetry. And foot volumetry is a very meaningful instrument because you can measure the amount of blood which is pumped up towards the heart, which we call expelled volume. So the patient does exercise here, knee bending exercise, and with every knee bend, you get a decrease of volume of the foot, which is pumped up towards the heart. And we have normal values, which are about 18 in average. And then we can see that, for instance, patients with varicose veins, with chronic venous insufficiency, post-thrombotic syndrome, have significantly lower expelled volume values, and with a stocking you are able to increase significantly this expelled volume. So without and with the stocking you are increasing the expelled volume, which is there's more blood pumped up to the heart in patients with varicose veins. Chronic venous insufficiency, as we called it at this time, this is already some time ago. Not so much in post-thrombotic syndrome. As you see, In post-thrombotic syndrome, obviously, this stocking did not produce the same beneficial effect as we had it in superficial venous disease. This is what I took from the Stemmer book, which was published here in Paris in the year 2000. And these are own experiments, again showing that there is an increase of expelled volume with increasing pressure of the lower leg. You can also do venous pressure measurement in the dorsal foot vein, an invasive method, and combine it with foot volumetry. And this is just one example I want to show you. Here, this is the situation without the stocking, and the curve should be read from the right side to the left side. So you see expelled volume was 12, and the pressure fall during knee bends was 41. Then we put on a stocking, and you see here that the expelled volume was doubled by the stocking. So there's much more blood pumped up towards the heart with the stocking. But when you look at the pressure, only a very minimal improvement of the venous pressure happened. The venous filling time was prolonged. Air plethysmography, another elegant method in order to assess effects of compression. And since we will have some discussion about this question of static stiffness index, of the importance of this parameter, I brought you some experiments from Giovanni Mosti, and you see there is a clear correlation between static stiffness index and ejection fraction. So the higher the static stiffness index, the higher is the ejection fraction. This was done in a group of patients with large varicose veins using mainly bandages, inelastic and elastic bandages. Microcirculation. There are many methods looking at microcirculation. We had Michael Jünger there, and he presented his very elegant findings in intracapillary pressure measurement. So he really was able to puncture capillaries in the nail fold. You can imagine this is not quite easy. Blood capillaries, not lymphatics. And he measured the pressure changes when he did a passive contraction of the calf. And he was able to show improvement of this pumping function in patients with chronic venous insufficiency when he put on compression stockings.